name is Sterling Cannon. I'm oculoplastic surgeon here at West Georgia Eye Care. I went to medical school, University of Miami. I did my internship year here at the hospital formerly known as the Medical Center. Then traveled out to Oklahoma to do residency and fellowship at the Dean A. McGee Eye Institute. Did my fellowship in facial reconstructive and oculoplastic surgery. I came here in 2005 and have been here, it's been 10 years. It's hard to believe it's gone so quickly, but it's been a great 10 years. It's a great place to raise a family. My wife's family is from here and it's been great. The community has been very welcoming. The thing I really loved about ophthalmology was the ability to make a huge difference in patients' lives in a very short amount of time. The procedures that we do are typically easy to bounce back from, but they make a big difference. When patients come in, you get to really interact with them at a vulnerable time in their life and do something to really help them with how they function. That's the window to the world. That's how they, that's how they see things. And so to be able to affect that system so profoundly in such a small amount of time was really fascinating. And that's what attracted me to ophthalmology. The most important thing I view my job is to put myself in their shoes. When they're coming to the office, they don't know what to expect, but they do have something that's bothering them or else they wouldn't be there. My job is to figure out what's bothering them the most and offer solutions to that problem with the least amount of risk possible. Once I can identify something I can really help them with, then just making sure that they know everything about what we're going to do and keep them in the process as far as deciding what to do and what not to do. I try not to give anyone a problem they didn't walk in with, but if there's something that's really bothering them, I want to offer help. And most of the time we can with great success. The thing that's most rewarding about what I do is usually the 5-week post-op. When the patient is happy, I'm happy. When they've come to me with a problem, we've been able to provide a solution. They've tolerated it well and are ready to go back out into the world and seeing better, feeling better, looking better. It never gets old. It's wonderful. One of the most satisfying things is this one patient that had been tearing for about 20 years and had just chalked it up to something that was part of life for her. Tearing is a really socially affecting problem. People interpret it as, sadness. That's, and they go throughout their lives dabbing their eye and with their glasses wet, and we were able to provide a solution that cured her of her tearing. Now she doesn't have to do that for the rest of her life, and it's just, things like that are really heartwarming.